Hello, my name is Javier Villagomez.
Hello, my name is Raul Soto.
Hello, my name is Jesus again.
And we'll be talking about cardiovascular and pulmonary conditions. There are two major categories of cardiovascular diseases. They are ischemic conditions and cardiac muscle dysfunctions. The first cardiovascular disease we'll be talking about are ischemic conditions. These occur due to a lack of blood flow caused by a blocked blood vessel, resulting in the inadequate oxygenation of tissues. This is especially harmful for organs such as the heart and the brain. Common ischemic conditions are coronary heart disease or arteriosclerosis, which is a hardening of a blood vessel wall, and angina, which refers to the pain felt in one's chest due to ischemia of the heart muscle. The next category are cardiac muscle dysfunctions. This term refers to conditions associated with heart failure. Heart failure occurs when a disease process or defect, directly or indirectly, causes a decrease in the pumping capability of the heart. A significant event that may occur due to a cardiac muscle dysfunction is a myocardial infarction, aka a heart attack. An infarction may be caused by an embolus or clot, cutting off blood supply to an area of the heart, causing tissue death and, as a result, the infarction. Congestive heart failure occurs when the heart muscle is so compromised that the heart is no longer able to efficiently pump blood. Next, we'll talk about lung conditions. The first category are obstructive pulmonary disorders. These are caused by pathological changes in the lung that result in poor airflow through the bronchial tubes. Common conditions are chronic bronchitis, which is constant inflammation of the bronchi, emphysema, which is air being trapped in the bronchi, asthma, which are bronchial spasms, and cystic fibrosis, which are mucosal glands congesting the bronchi. The next category are chronic obstructive pulmonary disorders. This refers to a group of disorders that cause symptoms such as chronic productive cough and excessive mucus production, as shown here.
Sir, are you okay?
Yeah, I've just had this really bad cough lately. I can't really get rid of it.
And finally, dyspnea. Here we can see a client struggling with shortness of breath and an abnormal breathing sound. Next, we'll talk about restrictive lung diseases. These occur when the lungs are unable to fully expand, and because they cannot fully expand, they are unable to process as much air as they normally would. Some causes include air pollutants, infections of the lungs such as pneumonia, and cancers of the lungs. Signs and symptoms of restrictive lung diseases include a non-productive cough, as shown here, and finally, tachypnea. Not to be confused with dyspnea, we notice he is not struggling to breathe and his breaths are not shallow, but instead he has an increase in his rate of breathing overall. Next, we have examinations. Examinations include a review of a patient's past medical and social history, as well as a review of their body systems. What is looked at here are their physical, functional, and psychological parameters. Other things to take into account are the patient's age, the severity of their problem, and their stage of recovery and rehab. Before we continue, it is important to make clear the goal of the rehabilitation process is to have the patient return to their way of living as closely as possible. If this is not possible, it is the therapist's job to help the patient achieve their full recovery potential. Next, we have rehab procedures. Rehab procedures for the heart include monitoring a patient's response to exercise. Here, we see a physical therapist carefully observing his patient's response on the elliptical. The next procedure is having the patient exercise in their working range or their safe zone. A patient's working range represents the minimum and maximum heart rates that must be achieved to create a training effect. First, we must find the patient's maximum heart rate. We can find this by taking the number 220 and subtracting the patient's age. This will give us a value of 198 beats per minute. Next, we will multiply the desired intensity of 60% of the patient's maximum heart rate, giving us a working range of 118 beats per minute. Then we will apply the same formula but with 80% of the patient's maximum heart rate, giving us a value of 168 beats per minute, and a working range of 118 to 168 beats per minute. This means that during exercise, a patient's heart rate should hover somewhere between these two numbers. Finding the working range for patients with heart disease uses a similar formula. We begin by checking the patient's pulse to find their resting heart rate and then adding 20 to 30 beats per minute. As an example, we'll use a resting heart rate of 70 beats per minute and add 20, giving us 90 beats per minute, and do the same with 30, giving us 100 beats per minute. The range here would be 90 to 100 beats per minute. It's important to note that a patient with cardiac disease may not exceed 120 beats per minute, as this may strain their heart. When it comes to rehab procedures of the lungs, in physical therapy, the most common is postural drainage, as demonstrated here. Postural drainage is commonly applied to patients with obstructive pulmonary disease, as they produce excess mucus in the bronchi. The goal of postural drainage is to position the patient to passively drain fluid out of specific areas of the lungs. Percussion can also be applied for better results. Next, we'll talk about preventative strategies. While physical therapy tends to be mostly restorative care, preventative care must also be implemented to ward off future disease. Simple yet consistent practices such as proper nutrition and regular exercise will pay dividends in the long-term health of a patient. The same can be said for weight loss and blood pressure control, as well as avoiding bad habits such as smoking and living a sedentary lifestyle.